Another way in which randomization can be implemented is randomized phase-in. Under this method, everybody participates in the project in the end, but the order in which individuals begin the program is randomized. In other words, maybe 1/2 of the people are invited to participate in the first year of the project, while the other group has to wait for 1 year. The group that is waiting to participate can be used as a control group under some conditions. A problem may arise if participants know that they will be enrolled in the program later and adjust their behavior. You should therefore be careful when opting for this method. Are people likely to change their behavior if they know that they will participate in the future? If yes, can you prevent them from learning that they will participate in the future? If you cannot, you might want to think about a different design. Let's look at a practical example of the phase-in design. Suppose we are interested in knowing the true benefit of the provision of a microcredit scheme. Before we start the project and give out the first loans, we randomly assign people into 2 groups. One group who gets the loans and a control group who will get nothing now but will have access to loans next year. If the individuals who do not get the loan now know that they will be eligible for a loan in the upcoming year, they might postpone planned investments. For example, they might not buy improved seeds or will not buy a motorbike to start a taxi service now, but will wait for another year. At this point, they know they'll be able to get a loan from the microcredit scheme. Under this evaluation design, the microcredit scheme would seem to be a very effective tool in encouraging the poor to start a business, but the true effect would remain blurred. Was it really the loans that made people invest more? Or was this observed difference between outcomes the result of comparing new businesses started by those in the program with a group of people who were waiting to start a business? In other words, the difference might result from both a higher rate of investment of those in the treatment group as well as a lower rate of investment of those in the control group. In such a case, the phase-in design does not seem to be a proper methodology for the evaluation, and you should consider using a different method. On the other hand, consider a program providing maternal health care services. This program randomly opens healthcare centers in rural areas. In some areas, the healthcare centers open earlier, and in some they open later, and the order that they are built and opened is determined randomly. At the end of the project, the entire area is covered. It is worth noting that here we are talking about a phase-in randomization at the village level. As long as the geographic spread is vast enough, the women are unlikely to seek maternal health care outside of their villages. If this condition is satisfied, we're able to estimate the effect of the health centers on maternal health and other variables of interest by comparing mothers and their children in the treatment villages, those villages that got the first phase-in, and mothers and children in the control villages. This program seems to be a good candidate for the phased-in randomization design. We have discussed the problems arising at the time when we plan randomization. However, serious problems may arise even if we get the randomization right. Not all individuals who enroll in a program will successfully complete it. This problem is called attrition. If we assume that the people are dropping out at random, say by having an accident, and this is obviously unrelated to our program. The results of an evaluation in which we compare the key characteristics of the treatment and the control group would still be valid. Yet, often the reason that people drop out of a program is related to personal characteristics, and this simultaneously affects whether they drop out of the program and outcomes such as income and health. Such non-random attrition may lead to a bias in the estimation of the true effect of the program. Here's why. Consider a vocational training program which is aimed at improving working skills of, say, carpenters. It may be the case that the course is too demanding for some people, and these people may decide to quit the program. If you do an evaluation, the project would seem much better than it actually was, as you only see the high-quality apprentices finishing the course, and these individuals would be more likely to succeed anyway, even without any assistance. On the other hand, the course might be too easy for highly skilled workers. For these people, the training might be a waste of time. In this case, you end up with a seemingly unsuccessful project, as the apprentices who finish the course are the unsuccessful bunch, and you compare these people with people of average quality in the control group. Ideally, you would want to adjust the control or treatment group so that you compare apples to apples. You should try to track people who dropped out and survey them too. This might be very costly, especially if the dropout rate is high. Even if you don't have resources to follow up on every dropout, you can select a random sample of the group which dropped out and survey them only. In this section, we have covered how proper randomization allows us to obtain an unbiased estimate of a program's effect. This is the difference in outcomes between randomly selected treatment and control groups. Yet unless we have some deeper understanding of what is going on, we end up having a number which either tells us that the program worked or that it didn't work. This information is insufficient, and we should go on to ask, how does the program work or why does it fail? When you are designing the evaluation, you should think of all the channels through which the program might operate in order to understand what is going right or wrong. Think of the example of the vocational training for carpenters and assume that we are able to estimate the effect without attrition. But the program turns out to be a failure, and it did not deliver the expected increase in new businesses. Was the training a failure, or was there another reason? What if the problem was not lack of skills, but a credit constraint, which prevented the trainees from purchasing the necessary tools? If you thought of this in advance, you could have randomly offered training with and without a donation of necessary tools to see what really matters here. This would tell you what type of assistance has the highest return on investment. Importantly, what you learn from an evaluation in country X does not necessarily apply to country Y. However, if you have conducted a proper impact evaluation, you know more about why the program worked and what problems you might expect when implementing it in a different setting.